Hi, friends. Welcome back to Inlera University. My name is Jasmine. I'm so happy that you are here with me today. Today is a very exciting day. Those of you who've hung out with us these last few weeks know that we have been bringing in some of the industry's experts for you to learn from and glean all of the information that you are hoping to learn about the world of healthcare and the business side of healthcare, not specifically in medical billing, but those areas that support medical billing, the other areas that are necessary pieces that you potentially could dive into and use as the next stepping stone to your ideal career. So today we have a really special guest. I'm so excited because she's rejoining us after a very long time, someone who I have not spoken with here on the channel in we just talked about it, almost 5 years, you guys. So we went through the whole pandemic hanging out together. And I'm excited to bring Miss Lucreia Bennett from CodeMaster Coach here on YouTube back with us. So let's give a nice warm welcome for Miss Lucreia. Hi, Lucreia.
Hi, it's good to be here. It's been a long time.
I'm so happy that you're here. Thank you so much for being willing to come on and speak to the community again, and just share a little bit of your wisdom. We know that you have so much to share, so thank you for that.
Thank you. No, it's good to be back, Jasmine. It's been a while. It's just industry. I mean, life is lifing, as they say. Staying busy, doing what I know to do. Teach medical coding.
Love it. So speaking of that, for those folks who are not familiar with the CodeMaster Coach's channel and what CodeMaster Coach offers, can you say just a brief explanation about what exactly CodeMaster Coach is and what you do on that space?
Yes, I can. Coming from years of experience in the health information management profession, I've been in this profession probably 35 years, telling my age, but I just started as a director of HIM and deciding, you know what, I'm going to step back. During the COVID epidemic, I had an opportunity to work remotely. And I said, you know, medical coding might be an avenue that I could enjoy logging on, doing, and logging off. Sure, the director position was good, but like I said, knowing I was going to do this interview, it prompted me to think about my CPC experience when I wanted to get certified in medical coding. And so I did recently put out a video because it brought back a bunch of thoughts trying to prepare for today. And I thought about it and I said, well, coders make really good salaries. So if I'm overseeing supervising, why not go and get certified myself? I had the RHIA, which would still allow me to code, but I knew within myself I wasn't ready to just jump into coding full time. So I ventured out and I started looking for, I knew I wanted to be a professional coder. So I was looking for a CPC program and had some frustrations and along the way. And so as I was studying, I just said, you know what? I'm making my notes, I'm studying. This could probably help others. And so then my son kept telling Mama, YouTube. And so as I would study and create a lesson plan, I would record myself and put it on YouTube, and others seemed to appreciate it to a point where I grew so fast. I had people saying, can you teach an entire class? But it was hard to do on YouTube. So then I just created CodeMaster Coach. And as I was preparing lesson plans, I started putting them on YouTube, started building my own program. And that's where we are today. I have a full, complete CPC medical coding program.
I love that. Thank you so much for sharing your wisdom and it's interesting because your story is different than a lot of the stories that we've had recently on the channel, which are people who have started from kind of an entry level care and going into trying to move into management. And now you've started going right in, high level degree. You're like, I'm going all into managing people, which is like an undertaking in itself that you would choose to, I did watch your video actually on the CPC your journey going into CPC. And I love and appreciate the authenticity of what you said, which is that you realized that you just didn't want to manage people anymore. You were ready to be responsible for yourself and do the work and not have to be tortured by what someone else's output is and what their personal lives have to offer, all the other stuff that gets messy, and also stressful, right? So
yes.
Thank you for sharing that. And so if you guys haven't seen that, go check it out. It's on CodeMaster Coach's channel. I think it's like my journey to CPC from just a couple of days ago. So love it. So tell me, in this long journey that you've had from healthcare leadership position now into CodeMaster Coach, what are the most valuable lessons you have learned in that time?
With this profession, I have learned it is what I make of it. If I don't get in there and really exert myself and express myself and do things with what I know, this profession isn't working for me. So I've learned to make it work. I jumped on YouTube, colleges, I teach, I do consulting on the side, I do trainings, I work full-time in medical coding. There's so many avenues. So I've learned with this profession, it is what I make of it. So I can either log on and work 8 to 5 and get off, or I can work 8 to 5 with one company, work weekends with another. But I'm getting so old now, I don't really jump out there and do as much as I used to. But I've learned, again, with this profession, seeing the coding and billing side of healthcare, I think I'm seeing a whole lot more than others that are working on the floor in the healthcare facilities. I'm seeing it in writing, but I'm seeing it and I'm enjoying it.
I love that. That is so, I really appreciate that you are able to embrace the flexibility, the potential flexibility that you can achieve. I know that there are a lot of folks out there who are interested in doing some consulting or maybe having a little bit more flexibility in their coding, but there is that reliance on staying connected to one company and having that salary. So I know that it's a risk, and I know it's something that people are interested in taking. So that's definitely something we should chat about a lot more in the future, because I'd love to support those people who are excited about taking on some more contract work and having that flexibility. But there are some realities, right? There's some realities that need to be talked about, which is that you're not relying on that company, and that also means that you can't rely on their benefits and the other things that they might offer you from being a full-time employee, but you get all of these other things in exchange, which is the opportunity to say no to stuff when you don't want to do it, and the freedom to say, you know what, I don't feel like working this week or this month, and I've got enough from that last project. Or so, and you can always kind of say yes and take on more, and say no when you really want to take on less, like during the holiday season.
Right.
Love it. So how would you recommend someone get a career in coding?
Number one, research it. I'm amazed how many students come in thinking this is just an IT position. Coding, oh, we're doing coding. It's IT. It's IT with healthcare. And you've got to have that healthcare knowledge to get in and do the medical coding. So make sure you do your research, understand exactly what medical coding is. And while you're studying, I don't think people realize that there's a facility side of coding as well as a professional side of coding. When I start my classes off, I always tell my students, I said, wow, where do medical coders come from? I said, think about healthcare. And this is where I always tell my age. I say, I can remember seeing stories on TV where the prominent person in town had the biggest house. And if you were sick, they always went there, and it ended up being the doctor. And then how we now have hospitals. And when they used to file the claim, the hospital filed the claim. The check came to the hospital, and the hospital was expected to pay the physician, pay nurses, pay dietary, pay radiology. I mean, everybody's hand was in that check. And then physicians started saying they wanted more out of that check, which cut back on dietary, nursing, other areas. Well, then the hospital still had to put carpet down, paint, keep the exterior. There were so many hands in that pie that I understand why physicians had to start their own classification. That's why we have CPT, They had to start their own classification so that they could start their own check from third-party payer coming in so that they can be compensated for their services. So I always tell students, we're the person, we're that individual that can find those avenues where physicians are involved and should be compensated and paid. So what better profession to be in?
I love that. Thank you for that history lesson. There's a lot of people who don't realize that, we started in this, like, everybody being under one roof to people moving into independent practices. And there has been some migration in and out of those models where people have gotten back into those hospital networks and larger group systems, but it's actually from where we came, right? So
Exactly.
it's a fun history lesson. So I love this. So I also want to make a reference that you mentioned the word research and the irony that you would say that someone would need to and have the desire to research to find out more whether medical coding is the industry for them, when in fact, research is one of the core components of a medical coder's job, right?
Yes. We do a lot of research, a lot of reading.
It's all research. So if you find yourself struggling just researching about medical coding, you probably aren't interested.
This might not be for you.
Right. Let's be real, right? It's like, it's probably not the career. Let's not try to force something in there, square peg, round hole situation.
Right.
So if someone's researching and they find themselves looking for a medical coding program, what is the best way the best way for them to find a medical coding program like that? What would you recommend the steps that they take?
With doing their research, I would recommend that there's two websites, AAPC, www.aapc.com, and AHIMA, www.ahima.org. Those are the two national associations that medical coders tend to come out of. AAPC does keep track, AHIMA as well, of accredited schools, approved schools. I always tell my students, most coding programs are approved. Degree programs are accredited. So if you're looking for a medical coding school, AAPC has a list on their website that you can go to based on your state. Or if you're looking for just a remote, there are several out there. But go to the national associations, go to their websites and find schools.
That is a really, really great tip, and really pointing them in a direction of deciding then potentially what credentials they want to pursue then, right? Because that's at the end of the day, we want people who are going to be able to be competitive in the marketplace, and having those credentials is one of those ways, right? You could absolutely go get medical coding training and choose not to take an exam, but what's the purpose of that? You're taking the training, get the confirmation from that certifying body that you have the skills, and also are able to maintain those skills by keeping yourself up to date.
Correct.
What do you think is the most, let's talk about this actually. Now that if someone is trying to decide between AAPC and AHIMA, what does that choice look like? What do you think is the kind of the main thing that they should be looking for before making a decision on whether AAPC or AHIMA is right for them?
The way that I describe it to my students, I said, we started with AHIMA. I call AHIMA the mothership. Anything health information related, used to be medical transcription, medical coding, EHR, anything health information related, the mothership, AHIMA. But I always say coders, we felt like AHIMA got so big into lobbying and with the EHR that coders pulled away and started their own national association, AAPC. With moving to AAPC, there was kind of a feel of AAPC is outpatient, AHIMA is inpatient. But AAPC has done a lot of growing in the last couple of years. When you go through the certifications through AAPC, you'll see that they have all kinds of CPC, outpatient specialty certifications. But you know what? They're getting more into inpatient. So I can't say AHIMA is inpatient, AAPC is outpatient. So I always say use both sites, use both national associations to find out exactly what avenue works best for you. Are you that inpatient coder, or are you more excited and intrigued about emergency room and outpatient and physician office coding? If that's the case, then you're more of an outpatient coder. But you got to be that person that can capture. I always say, I'm my physician's moneymaker. I got to be that person that when my physician leaves the office for the day, I have a way of tracking if he makes any ER stops, if he goes by the ER and sees patients, or by the hospital to do rounds. Whatever my physician does, I need to capture those charges. I need him to communicate with me or view that record so that I can generate a claim for those services.
That's such great advice, and really appreciate the fact that you even see yourself as, what we talk a lot in the revenue cycle industry is that we are the drivers of that revenue. So our goals, our desires are to support the providers and their goals, and who the leaders are, really them being compensated for the hard work that they do. And I love that you think in that same, and along that same line as even as a coder, because there's a lot of coders that separate themselves from the revenue cycle. And I'm like, it's all part of the same thing. You can't separate yourself from the revenue cycle. You are a part of the sum. And so you have to keep that in mind is, yes, we're not looking at doing anything that's non-compliant, but we're looking at where can I really make sure that the work that's being done is being represented for the purposes of our provider being compensated. And that, it ties together beautifully with everything that we do talk about on this channel too, with the medical billing. So I love that. So tell me what you think the most important skill is that someone should have when they want to be a medical coder. What do you think are the most important skills that someone should have?
That's really interesting, because different people will probably say different things. When I first started coding, because I really didn't understand a lot of the different diagnoses and what was going on, and this is the type of teacher I am. I always say I wanted to feel what the patient was going through so that I could better understand and try to code it. But I've learned, rather than asking to feel it, I don't want to feel pain, let me do my research. So if I'm reading a chart and the patient's going through something, I quickly look it up real quick or Google it real quick to see exactly what are the signs and the symptoms. What can I expect? What is the treatment? Try to be as knowledgeable about what I'm coding so that I'll know what to look for in the chart. But not everybody thinks to go that step, and I know that. And so I try to motivate my coders and say, look, think about what's going on with your patient. Don't necessarily have the empathy. I don't want to say get that empathy, but understand and do your research to understand the difference between the diagnoses and the procedure, and what to expect and what to look for. What are the signs and the symptoms? Because through that process, you're able to determine what the diagnosis is so that you can more accurately code it.
I appreciate that so much. Even the word empathy in general, and weaving that into what we're doing, because there's so many, I try to remind people of this. There's some people that separate themselves from the role and the individual patient or the experience, right? It's like we ourselves are all patients at some point in our life's journey, right? And so you have the opportunity to see yourself in this other person's shoes and recognize that what is the next best step? What should I do? What's the right thing to do? And using that empathy to kind of guide you and be your own inner compass, right? And that's even true from the perspective of the revenue cycle focus and medical billing. It's like, what's the goal here at the end of the day? Like, there are so many people that push against, like, I'm just going to bill the patient. I'm just going to, and it's like, well, what's the goal here? The goal here is to get this paid, and we are hopefully allies in that process. The patient's goal is the same. Like, they don't want you to not get paid, but they would like to hopefully leverage their insurance coverage to get that done. And so it's recognizing that we all share the same ultimate goal. So trying to see yourself and that other person is going to help along the way for you to make the best decisions, right?
Correct.
So good. So good. I love it. So I am so excited that you came back on the channel. This is not going to be our last conversation. We are going to continue having more chats. I'm just thrilled that you were willing to share your wisdom, and thank you so much for taking the time. So if someone wants to get connected to CodeMaster Coach, and if they're not already following you on YouTube, first of all, they need to go to your page and follow you or subscribe to the channel and interact with those videos, because you've got such great wisdom and really just a wealth of content out there. So thank you so much for that platform. But what are the other ways that folks could connect with you?
Again, CodeMasterCoach@gmail is my email to direct email to me. And then like you said, my YouTube channel. But I always tell my students, if you're looking for a medical coding program, think about CodeMaster Coach. But I don't want to just market my program. I'm saying, look for an instructor that talks to you, that speaks to you. It's weird you were talking about how the different cases, and we were talking about empathy. Even when we do our exercises in class, I tell my students, this is your patient. How are you going to, it's an exercise question, but I'm saying this is your patient. How are you going to code this example? Find that instructor that speaks your language and can break things down to a point where you understand it. Because again, I shared my experience. I've been in a class where I got lost more than one time. And I had to break this stuff down so that I could understand it. Because coding, I would love to see coders and billers in the same area. In the hospital, you see the billers on one floor, medical coders on an. We need to work even closer. There are so many rules I already have with medical coding. I don't want to learn those billing, but I know we have to learn a little bit. But if I could work side by side with the biller that's billing the claim that I just coded, and learning some of the stuff that you guys are running into as far as edits and, oh, it needs a modifier. And I'm thinking, oh, I'm the one to put, and I'm like, wow, billers have a lot to learn on their guidelines. And I know billers say coders have theirs, but if we came together, these two professions, yes, we could generate those claims. We could make some money.
Yes. Oh, I love, that I'm all about collaboration. So I love that you would say that, because for sure there's too many, especially the organizations in healthcare grow larger. Things are siloed in such a strange way. And there's like this us and them positioning against each other. It's like, wait a minute, we're all part of this same cycle, and the revenue cycle can only run smoothly if things flow from one place to the next. And that really can only happen when there's an understanding of all of the downstream impacts, right? It's like what I do as a front desk team member impacts what happens for the coders, and that impacts what happens for the billers, and that like it just continues down the cycle. And it's important that we understand that, and also seek solutions to smooth it out, to make it better. And that's only possible if folks can work together, collaborative, not because the leadership says you have to do it this way or that way, but instead, what's the best thing? I could just call that coder and ask for, and you could learn something too. If you reach out to your coders, you're like, oh, I had no idea that was, the reason why you can't use this modifier with this particular procedure code, or I didn't know that diagnosis expired, or, whatever, who knows, like you can learn something, and that can make you more powerful, and then also strengthen the organization as well, right? It makes the organization more sound. Yes.
Reimbursement.
So tell me a little bit more about the program. You were just talking about the medical coding programs that you have. So tell us a little bit more about what types of programs you offer right now in your CodeMaster Coach program.
My program is a CPC certification program. I know a lot of people say, what about the RHIT, RHIA? I just do the CPC program, and I have 7 classes, medical coding level. Well, you start with medical terminology. You've got to learn that language of medicine. And I always say, it used to be where, why can't we just send in, for example, a sore throat? It's just a sore throat, just send in diagnose sore throat. Well, what's a sore throat to you? Could be strep throat to another doctor, could be acute sore. There's so many different languages as far as diagnosing, till you got to first learn the language of medicine, medical terminology. And then my program, I know I'm one of the long programs. I always say, if you can learn things quickly, find you a quick 7-week, 9-week class, go ahead and prepare for your CPC exam. Each one of my classes, there's 7. Each one is 12 weeks long, because that's the kind of learning that I need. I need time. I need time to understand exactly what's going on. I don't want to throw an ICD-10 book at you, which is 33 chapters long, and say, study it, do it. I want to break each chapter down and explain difference in the different diagnoses and the different body systems and exactly how to code it. So after medical terminology, you go to medical coding level 1, where we start the first half of ICD-10. And then the second half is in medical coding level 2. Again, all 12-week classes. And after the diagnoses, and we go into CPT and intro to CPT. And of course, we have to do that professional coding. So that's where CPC comes in. And then you go to medical coding level 3, where we do the diagnoses and the procedures together. And then we do offer a billing and reimbursement class, because they're looking for coders that can do coding and billing, but only few can do that. And then a prep course preparing you for this exam. This 4-hour, 100-question exam is a very hard exam. So I actually have a 12-week class that prepares you just for the CPC exam. But I always ask my students, make sure you've already learned to do the coding. That's just the prep course for the exam. So a lot of students think, oh, I could just take your CPC prep and go take the exam. No, you got to already have your coding knowledge. The prep course is just to prepare you for your studies. So again, I have 7 classes. I'll be starting a class next week. Next Tuesday, we're going to actually start. But by Sunday, I try to get my welcome packet out to everybody that's registered and say, come on, let's take this journey together, because we got a road ahead of us. It's tough, but we can do it together. And I do meet with my students on Zoom, 3 to 4 times a week per class. Because again, I got to make sure you're understanding this material that you're learning. But again, that's CodeMaster Coach. That's my program.
Thank you for sharing. Thank you so much for sharing that. I really appreciate that. What your unique selling point is in your program is the fact that people leave and they know how to code, right? It's very different. There are so many programs out there that, like you said, they're quick, you do a few weeks, you go sit down for your exam, and then you're just like thrown out there and sink or swim. And most people, and you can look at the comments on all the various channels, videos, and all the things, like most people struggle because it's hard. You have to build confidence to make a decision. That's honestly, I think the heart of it is it's very contingent upon, well, maybe it could be this, or maybe it could be that. Like, you have to confidently decide, these are the codes that I'm going to choose, and by way of the documentation. And it takes practice to build that muscle, that confidence to say, okay, I'm going to pick these codes because of all these facts that align with it, that support it. And you can say that this is why you're making this decision. And that only comes because you've had experience. So I think it's wonderful that you have built that type of program that really produces people that are ready to serve the industry, and not just out there just kind of trying their hand at coding.
It is hard enough to go into a new job and having to learn their software. As a new coder, let me come in. I know how to code. I can code. There's no question. I can do the coding. But learning their software, that's enough. But then you just took a quick class, and now you're coming in and you got to learn how to code and
Yeah. And God forbid they have some high level production expectations as well.
Exactly.
There you are trying to code, trying to kind of fiddle with it, and then you got to produce 40 charts a day or something like that. So
or an hour.
Could you imagine? So I love it. Well, thank you so much for sharing your wisdom, CodeMaster Coach. We look forward to seeing you back in this space again. And those of you, if you haven't already subscribed to CodeMaster Coach's channel, check her out here on YouTube, and you can reach out to her. We'll put all of the links in the description box below this video, and I will see you guys in the next video. Take care, my friends.